Today we are discussing one of the pervasive developmental disorders, called it as Asperger's disorder. It falls under one of the autistic spectrum disorders. You all know that pervasive developmental disorders are of various types. We can categorize them into different varieties. So, now we will be seeing the symptoms, the signs, the causes of this particular disorder. This Asperger's syndrome, it rarely occurs like 1 in 200 people. It affects the people in the ratio of 1 in 200, and it is mostly predominant in males rather than the female. Generally, people who are affected with this disorder are of average intelligence or above average intelligence. So, you cannot say like they are mentally retarded or they are falling under the category of idiot or imbecile. So, they do possess normal intelligence and sometimes even slightly above average also. This condition, that is Asperger's syndrome, is also characterized with difficulties like communication, interaction, flexibility in thinking and imagination, and also organizing the situations. That is, they lack the organizing capacities. Sometimes apart from this, we also see sensory difficulties and also motor coordination. This Asperger's syndrome, though falls under the autistic spectrum disorder, it is slightly different from this autistic spectrum. The reason is, in Asperger's disorder, we do not see any complete absence of language or cognitive development. We do see relative development of language and cognitive process, which is unlike the autistic spectrum disorders. Asperger's syndrome was first identified over 50 years back by Hans Asperger, a Viennese pediatrician. He identified certain abilities, especially among boys, which included lack of empathy, impaired imagination, inability to make friendships, unable to handle the situations, and a sense of frustration and isolation among these people. He also identified certain motor coordination problems and perceptual problems. People with Asperger's syndrome will exhibit either all the characteristics or some of the characteristics to a greater or lesser degree. They may tend to experience isolation and frustration and feels dejected because they have difficulty in communicating and in interacting, that is, in interacting with the family members and also the people around. This may create the feeling of frustration and thus lowers the self-esteem of the individual. In the past, many children who were affected with Asperger's disorder also exhibited other spectrum disorders or some other disorders generally, but individuals with Asperger's syndrome are now showing only the characteristics which are confined to the symptoms of Asperger rather than the other disorders. Apart from the mentioned characteristics, these children who have this kind of a disorder also have repetitive behaviors or prefer to remain same, that is, they do not expect or they do not adjust to any kind of a change. So, this consistency is accepted and retained by the children with Asperger's syndrome. They are not ready to react or they are not ready to incorporate any kind of changes in the surroundings. Now, let us see what are the characteristics in detail. The first symptom is social interaction. Children with Asperger's syndrome cannot pick up the nonverbal cues in our interaction, and they cannot generally read the minds of the people. As a result, they continue to talk within themselves irrespective of whether others are interested in their talk or not. Most of their interactions are self-focused and with very narrowed interest of topics. Naturally, people cannot follow them or people may not have any interest in the topics discussed by the Asperger patients. But in reality, these children are actually navigating the social situations. However, because of the non-involvement of these children with the other people or lack of interest from the other side, ultimately resulting in the lowered self-esteem of these children. So, this is one main symptom which we see in the Asperger's syndrome. The next symptom is communication. People with Asperger's syndrome possess good language skills, but problem is they cannot understand or grasp the purpose of the conversation or the content of the conversation. They cannot comprehend jokes, idioms, metaphors and even the sarcasm. Their voices also sound monotonous and their language is idiosyncratic. Because of their narrowed interest in topics, they find it difficult to take the initiative and also sustain the interest of the people around. Ultimately, we can say that they lack the sharing of mutual ideas and feelings. They want to discuss only what they like, what they would like to, rather than what is the common thing that is liked by the people around. Another important characteristic is imagination and flexibility of thought. This particular symptom is very predominant in the children. They cannot imagine properly or they cannot bring about the flexibility in their thinking process. People with this syndrome exhibit this particular symptom in different ways. Because of their lack of imagination and because of their lack of flexibility, they cannot able to understand what other peoples are speaking. Not only that, even they take the literal meaning of what is said to them, and they also have difficulty in applying the knowledge and skills across different situations with different people. These problems occur merely because of the lack of flexibility in their thought process. Whatever we have discussed now, these are the main characteristics of Asperger's syndrome, that is lack of social interaction, lack of communication and lack of flexibility. Apart from this, there are other characteristics too. One such characteristic is problem with sensory stimuli. We can say people who are facing or who are undergoing this Asperger's syndrome have difficulty in dealing with this sensory stimuli. These children are very sensitive to this sensory stimuli. In fact, sometimes they are very hypersensitive also. They are very sensitive to the sensory stimuli like sounds, light and smell. Because of their hypersensitiveness to these kind of the situations, they feel they are overloaded. Naturally, they do not know how to handle the situation and experience or express feelings of anger and also sometimes anxiety. Whenever they fail to adapt to this kind of sensory stimuli, we see anger outbursts very frequently in these children. And because we cannot expect when the sensory stimuli would be very high to make an adjustment to these situations, it is very difficult to control their outbursts. So, there is a need to identify certain situations, that is anticipate certain situations, a feeling of overburden to these children in dealing with these sensory stimuli, so that we can prevent most of the anger outbursts and feelings of anxiety from these children. Another characteristic which we can see in the Asperger's syndrome is motor difficulties. These motor difficulties are exhibited in the children as awkward movements. They walk very clumsily and their behavior is also awkward, and they are unable to show the motor coordination in most of the actions. As a result, either they lack or sometimes they may delay in the development of certain motor skills. Because of this lack of motor skills, they are very poor in writing, in sports or in running. Another important characteristic is organizational difficulties. Organizational difficulties means these children always want to remain in permanent situations, in a routine way of situation. Any kind of a change, if we bring about in their routine, it is very difficult for them to adapt. And any kind of a uniqueness in the situation, bringing about newness in the situation, that creates a havoc for the child to deal with it. Unpredictable situations and conditions will bring about a considerable distress among these children. Even if these children make an effort to handle these situations, because of their lack of organizational strategies, they are unable to cope, and as a result experience further confusion and anxiety. So far we have seen the symptoms, main symptoms of Asperger's syndrome and the minor symptoms of Asperger's syndrome. Now let us see the signs or the signals of these symptoms in a child affected with the Asperger's syndrome. Suppose if we can identify these signs, naturally we can diagnose the child with this disorder in a more easy way and also at a very early age. Once we diagnose at a very early age, the intervention programs can also be programmed immediately, which can show a better improvement in the child with the Asperger's syndrome. Now let us see what are the signs related to the social interaction. A child exhibited with the social interaction will show the following signs. You can look at the slide. Children with Asperger's disorder might initiate interactions with others, but have difficulty in sustaining social interaction. They can interact with people only if they need something or talk about something that interests them, but not for the sake of being social or out of genuine interest in others. They also interact in an awkward and stilted way, that is, they may avoid eye contact while speaking or interpreting things literally. They interact more easily with adults than with children. They do not show emotion or empathy. These are the signs which we can observe in children who is lacking social interaction. If these signs are shown very frequently, naturally there is a scope for immediate action to identify and find out the reason for the particular behavior. If there is no other cause, and if we have to go for the diagnosis and see that whether the child is affected with this disorder or not. Similarly, to identify communication problems, there are certain signs. Let us see what are those signs are. Children with Asperger's disorder who exhibit communication problems do exhibit the following behaviors. Children will be very verbal, that is, they might label everything in a room. They join words together at the usual developmental stage, that is around 2 years. They also communicate with others, but only about their own interest. They use a flat or monotonous voice. Most often they answer questions, but they do not initiate questions if the topic does not interest them. So, if we observe these symptoms, that is these signs, naturally we can suspect any kind of a disorder is existing in the child. The another characteristic is repetitive behaviors. What sort of signs we can see in this particular child affected with the Asperger's syndrome related to the repetitive behaviors? Look at the slide. Children with Asperger's disorder might have restricted or obsessive interests that make them seem like walking encyclopedias about particular topics. They prefer only routine life and rules. They do not respond well to change. These are the main signs related to the repetitive movements which we see in children affected with this kind of a disorder. Once we have understood the symptoms, the signs related to the various components like social interaction, social communication, sensory stimuli, organizational difficulties, and related to the obsessive movements, we can just conclude the clinical picture of the Asperger's syndrome in the following way. The main clinical picture includes lack of empathy, naive, inappropriate, one-sided interaction, little or no ability to form friendships, repetitive speech, poor nonverbal communication, intense absorption in certain subjects, clumsy and ill coordinated movements and odd postures. So, this is the summarization of the clinical picture which we can see in a child with the Asperger's syndrome. However, there are also certain positive traits associated with this disorder. These children with Asperger's syndrome possess traits like honesty, dedication and reliability. These three traits are very predominant in most of these children who are suffering with this kind of a disorder. Now, the question arises, how do you identify a child who is affected with this disorder? Is it only by focusing on the symptoms and signs, or are there any tests which are available to administer and then come to the conclusion? Most of the psychologists say there is no single standardized test as such which can focus on all the symptoms and all the signs of the Asperger's syndrome. However, we have to take into consideration number of tests which will focus or which will provide us a comprehensive picture of the child who is affected with this disorder. Apart from the test, they also specifically try to identify some core behaviors which are present in these children. These core behaviors could be eye contact, whether the child is showing the eye contact or not in his interaction. Aloofness, whether the child is interacting or keeping himself aloof all the time. Failure to turn when called by the name. Generally, when we try to play with the child or when we are interacting, if we call the name, the child immediately turns and likes to hear his name. But if that is absent, that is one more indication of the existence of the symptom. Failure to show or point out towards certain objects, that is, the child is unable to use the gestures in showing or pointing out certain objects. Lack of interactive play. The child never tries to interact with his playmates. Even if the child is playing, it is solitary play rather than the interactive play. Another behavior which generally the professionals try to observe is lack of interest in the peers, that is, whether the child is showing any interest in talking to the peers or not showing any interest. Because for a particular age children, the most important thing is playing. They enjoy playing, they like to be with their own playmates. But if these things are missing, that is one indication that something is wrong in the development of the child. So, if we can focus whatever we have discussed now, the presence of these behaviors indicate that some problem is existing in the child, and further we have to see before we label the child or before we diagnose the child as affected with the Asperger's syndrome. Physical, emotional and mental tests were also administered to rule out any other causes for the child's behavior. If other causes are ruled out, then probably it would be easy for us to diagnose whether the child has this Asperger's syndrome or any other kind of a disorder. Coming to the treatment of the disorder, like any other particular disorder, there is no specific treatment as such for the Asperger's syndrome by itself. However, we can use medication to control other associated behavioral problems like hyperactivity, obsessive compulsiveness or emotional outbursts. The ideal treatment of Asperger's syndrome includes coordinating the medication, psychological therapies and learning strategies to the child, so that we can make the child adapt to the situations and show some improvement in his interaction and communication abilities. So, there is no single best effective treatment package for all the children of Asperger's syndrome, but definitely the earlier the diagnosis, the better the intervention would be. An effective treatment for this particular syndrome depends upon giving the child a structured situation so that the child will be ready to cooperate, teach the child a series of tasks at slower pace, that is in small steps, actively engage the child in highly structured situations and provide the positive reinforcements whenever we see the improvement in the child's behavior. All these things are very important in bringing about a change in the child's abilities and also in the interaction. The treatment also includes social skills training, cognitive therapies and behavior therapies to make the child learn some of the skills very faster and also to deal with certain inadequacies by providing them the moral support. Cognitive therapy helps the child to identify the emotions, learn to manage the emotions and bring about the balance in his interaction with the people without giving a way to the expression of negative emotions. So, the child learns how to control his anger or frustration or how to enhance the self-esteem. Similarly, when we use the behavior therapy, the child learns which behavior is encouraged, which behavior is appreciated by the people, under what situations he is able to get the positive strokes from the people, what sort of a reward or appreciation he is getting for which behaviors, and then gradually learns to control the negative behaviors. So, behavior therapists through shaping and reinforcement techniques help the child to develop the positive behaviors and avoid the negative behaviors. Occupational or physical therapy is also incorporated in the treatment program to see that the child is overcoming or the child is learning to deal with the motor difficulties. Once the child overcomes these motor difficulties, naturally he can master some new skills. Sometimes it is very difficult to know whether lack of abilities is making him feel frustrated and lowered self-esteem, or is it because of the low self-esteem he is not able to pick up the tasks. So, when we support the child feasible atmosphere, providing him the convenient situations where he can practice the learned skills repeatedly without any negative thought, naturally it would be easy for the child to pick up at least some of the new skills and leave the poor skills which the child has learnt in the past. Prognosis. However best the treatment is, you cannot expect 100% change in the children with this kind of the difficulties. However, they may be at a better edge in dealing with the life situations, but continuously they need support and the encouragement of the people around in learning the new situations, new tasks and also in sustaining these abilities. As adults, they might be streamlined along with the others into the workplace, but they also have somewhere that inability or feeling of inferiority, whether they can be on par with the abilities of others and can meet the expectations of the society. So, even as adults, they focus on the support of the people in maintaining their life. So, to some extent we can say that dependency will be there even under the positive atmosphere. In a nutshell, we can say Asperger's is one of the pervasive developmental disorders which falls under the autistic spectrum disorder. It is mostly seen in the males compared to the females. The main symptoms are lack of social interaction, lack of communication abilities and motor difficulties. Other symptoms include difficulties in dealing with the sensory stimuli and also in accepting the change, that is, they are more interested in doing the repetitive acts rather than accepting the new skills or new situations. We tend to see number of signs in order to identify them as affected with the disorder. There is no single test through which we can conduct and then infer, but professionals use or professionals seek for core behaviors which are present in the children affected with this disorder. If these core behaviors are present, naturally it would be easy to diagnose and then immediately provide the intervention. There is no such particular age as such, but the earlier the diagnosis, the better the intervention would be. The treatment includes not just the medication, because only medication cannot resolve the problem of this disorder, but medication will be used to treat the other coexisting disorders like hyperactivity or obsessive compulsiveness or anger outbursts, but psychological therapies like cognitive therapy, behavior therapy are widely used. Apart from these therapies, we try to see that the child is given the treatment in a proper structured environment where we can encourage the child's attention, where the child can repeatedly try the new way of behaving with the people or dealing with the situations, so that the consistency in the structure is not minimized, and it will be easy for the child to deal with the people around. Apart from this, we can say, like, though we try to make the child adapt to the life, still the child is dependent on certain things even as an adult, especially they require the psychological support, and the psychological dependency will be there forever.